Hello, Joanna. And understand that you're married and you have 2 children. And
yes, that's correct.
Okay. And I'm hoping that you'll be happy to talk today about some of the encounters with nurses, midwives, doctors that you've encountered as a woman who uses BSL, understand, British Sign Language, and is profoundly deaf.
Yeah, I am a BSL user. That is my preferred language. Sometimes I'll try and talk to people if there's no interpreter available. However, some people find my speech quite difficult to understand. So, a lot of the time as well, they hear my voice and they automatically assume that I have a learning disability or I'm foreign and from a different country, which is obviously not nice. So I would prefer to use BSL, like I say. However, most of the time, there's never an interpreter there. It can make things very difficult to explain, the explanation of why I'm at an appointment. Some doctors have a fantastic attitude and they'll use pen and paper to try and communicate, but some doctors have really strong accents, makes it impossible for me to lip read. I remember there was one time, my son was probably about 3, he was first diagnosed with having asthma, and I didn't quite fully understand how to use the inhaler. One evening he woke up and he was wheezing, but I'd already given him 3 puffs of his inhaler through the day, so I was like, I can't possibly give him any more. I wanted to give him some more, but I wasn't sure, so I actually ended up texting my friend who's a GP herself, saying that you could use the inhaler more than the 3 times that the doctor had said, but I didn't know that. The doctor never explained it fully to me. So I don't know what I would have done if I hadn't had a friend who's a doctor that I was able to text. When I was also going to hospital for my labour, it was very difficult to try and explain to all the different nurses, the midwives and so on, and the doctors and the consultants that I was deaf. I really got quite fed up. They were talking directly to my husband or to my mother. And they never directed it to me. It was me. I'm the one that's pregnant. I'm the patient. So a lot of the things, should have been stopped if they'd had, deaf awareness training or something like that, or they had actually booked an interpreter.
So they sound very negative experiences, and also quite frightening.
Yes, yeah, but it's quite funny really, because obviously I've got 2 children. I've had my children in 2 different hospitals now. The attitude was completely different. The first hospital was very negative. There was definitely no awareness, no patience, and it really, no effort to try and communicate with me. So I wasn't particularly happy. They weren't asking if I was okay or anything. But the second hospital was a different one that I went to, and there was a midwife actually there that could sign a little bit, and they'd come up to me, they'd make sure I was okay, that which was lovely. Their attitude was much better. They were asking if I wanted tea. They were using some basic signs. So the midwives and the doctors, I understand they're very busy, but it's obviously we're deaf patients. We need that interaction and would like to feel happy and relaxed within the hospital environment, especially after cesarean section. It can be,
So it's the negative experiences are backed by research that says many deaf clients do experience negative experiences, but it's also good to hear some positives. Can you help elaborate, see if, give us some ideas as health professionals how we could improve practice even more?
I think really it's just to remember that deaf people are just the same as hearing people. We're all the same. They want to be, they don't want to be a problem. They don't want to be seen as a problem. They're not being difficult, but sometimes, that's the reaction they get. They deserve the same treatment as anybody else, and so treat them as equals. I think if there's more time given to deaf patients, just to be a bit more patient with them, try different ways of communication. If the interpreter's not available, or lip speak, or try and find out how they communicate, what would make them feel happy and comfortable. So it's really important to make sure that the patient knows what's going on. Deaf people have always said, I'm the last to know what's happening. Well, I'm off for an operation, but I'm not sure what it's for. I don't know why I'm having this operation. So it's very important to make sure that the patient does know what is going on, especially with the medications and so on. Or, what other options they have available to them.
Thank you for that.
You're welcome.